Hi, I'm Dr. Dan Sindelar, and the whole idea of overall health being affected by oral health is based on the communication between physicians and dentists. And the physicians aren't trained in this area, so they're starting from a level that's a problem. But that is where our opportunity shows up. And what we do is we follow 5 steps to expand that circle of our influence and that circle of our practice. So here are the steps. First, whenever we have a new patient or even our current patients, we always verify who they see as a physician and when was the last time they saw them. I'm amazed at how they're not like dental patients. They come to us all the time. They're not trained to go to physicians often unless they have a problem. And that's where the biggest disconnect is. So we already in our practice have a good database for referring physicians in our area. We also know which patients do not go to a physician. Number 2, we've formed our Mastermind inner circle group of physicians from our area, and they are invited to be part of my circle, and that gives me an additional source to connect with. Now, if you just take your own group of existing patients and where they go, you'll find out you have patterns there. So expand upon that. Those are the people you need to personally seek out. If you have 50 patients that are mutual patients between your practice and Dr. So-and-so's practice, you're already friends. You have no idea how connected you are. You're seeing people that they have relationships with. Expand that. That will be the basis for your initial physician referral network. Third, we use a physician communication software in our practice. So inside this communication software, we have customized letters that go to primary care physicians, that go to preventive cardiology physicians, that go to physicians that are involved with sleep apnea, and we communicate with them. And that is the tool that makes it easy. Fourth, we customize those letters and we communicate all the time. Don't hesitate. You will be amazed at how appreciative physicians are if you're seeing a diabetic patient in your practice and you're monitoring how their periodontal disease is doing. You are helping that diabetic patient. The complications that show up for a diabetic patient because of lack of monitoring periodontal disease is huge. And so you're helping them with their care, and you are also having an opportunity to communicate with them, and we've incorporated some education into those letters so they understand why we're telling them this. And then last, number 5, from this group, do in-service meetings with their team and with the physicians just to help them. You've already, by this time, built out some relationships, so you're just basically having a nice talk with people that you're very comfortable with, and just elevate their understanding of what you're doing and what they're doing and the importance of it. Follow these steps and make your services available to the physicians and their patients. Do you have any concerns with communicating with physicians? Comment below.